Hello and welcome. Today we'll be discussing a complex condition, temporal bone fracture with vestibular impact. This injury, affecting the delicate structures within and around the ear, can have significant consequences for both hearing and balance. Join us as we explore the causes, symptoms, diagnosis, and treatment options for this challenging condition. So, what causes a temporal bone fracture? Typically, it's the result of significant blunt force trauma to the head. This can occur in a variety of situations, including motor vehicle accidents, falls, assaults, and sports-related injuries. The temporal bone, located on the side of the skull, houses crucial structures for hearing and balance, making it vulnerable to damage from these types of impacts. To understand the visual disturbances, we need to delve into the pathophysiology. A fracture of the temporal bone can directly damage the inner ear structures responsible for balance, specifically the vestibular system. This system includes the semicircular canals and otolith organs, which detect head movements and position. Damage to these structures can disrupt the normal flow of signals to the brain, leading to vertigo, dizziness, and nystagmus, involuntary rhythmic eye movements. The fracture can also damage the facial nerve, which passes through the temporal bone, potentially impacting eye closure and tear production. The fracture can also impact the oculomotor nerve, which controls eye movements. Unfortunately, precise epidemiological data on temporal bone fractures with vestibular involvement is limited. However, we know that temporal bone fractures, in general, occur in approximately 14 to 2% of all skull fractures. The incidence is higher in individuals involved in high-impact trauma situations, such as motor vehicle accidents. Men are also statistically more likely to experience temporal bone fractures than women, due to higher rates of trauma exposure. The signs and symptoms of a temporal bone fracture with vestibular impact can be varied and debilitating. Beyond the obvious head injury, common symptoms include hearing loss, which can be temporary or permanent. Vertigo, a sensation of spinning or imbalance, is a frequent complaint. Nystagmus, those involuntary eye movements we mentioned, is another key indicator. Patients may also experience facial paralysis or weakness, drainage of cerebrospinal fluid from the ear or nose, and bleeding from the ear. The visual symptoms include blurred vision, difficulty focusing, and sensitivity to light due to associated neurological damage and the disruption of vestibular ocular reflex. Diagnosing a temporal bone fracture typically involves a thorough physical examination and a detailed medical history. A crucial diagnostic tool is a high-resolution computed tomography, or CT scan, of the head. This imaging technique allows doctors to visualize the fracture line and assess the extent of the damage to the temporal bone and surrounding structures. Audiometry, a hearing test, is performed to evaluate the degree of hearing loss. Vestibular testing, including electronystagmography (ENG) or videonystagmography (VNG), helps to assess the function of the balance system. An eye exam is also crucial to evaluate the ocular motor nerve function and any visual disturbance. Temporal bone fractures are often classified based on the fracture line's orientation relative to the inner ear structures. Longitudinal fractures run parallel to the long axis of the petrous bone, a part of the temporal bone, and are more common. Transverse fractures run perpendicular to the long axis. A mixed fracture pattern may also occur. These classifications influence the potential for specific complications, such as hearing loss and facial nerve injury. Additionally, the presence or absence of cerebrospinal fluid leak is another important factor when classifying the fracture. Treatment and management of temporal bone fractures with vestibular involvement depend on the severity of the injury and the specific symptoms. In some cases, conservative management with pain medication, anti-nausea medication, and close monitoring is sufficient. For more severe cases, surgery may be necessary to repair the fracture, address any cerebrospinal fluid leaks, or decompress the facial nerve. Vestibular rehabilitation therapy plays a critical role in helping patients regain their balance and reduce vertigo. This involves a series of exercises designed to retrain the brain to compensate for the damage to the vestibular system. Eye muscle exercises may be required to recover ocular motor nerve function. Preventing temporal bone fractures largely revolves around minimizing the risk of head trauma. Wearing appropriate protective gear during activities such as sports, cycling, and motorcycling is essential. Practicing safe driving habits, including avoiding distracted driving and obeying traffic laws, can help prevent motor vehicle accidents. Fall prevention measures, such as improving home safety and addressing balance issues, are also important, especially for older adults. The prognosis for temporal bone fractures with vestibular impact varies depending on the severity of the injury and the individual's overall health. While some individuals recover fully, others may experience long-term complications such as hearing loss, vertigo, or facial paralysis. Recent research is focused on developing new strategies to improve outcomes, including advanced imaging techniques for earlier and more accurate diagnosis and novel therapies for vestibular rehabilitation. Stem cell research is another promising area, with the potential to regenerate damaged inner ear structures and restore hearing and balance. Thank you for joining us on this exploration of temporal bone fracture with vestibular impact.